we're going to do external and internal rotation at the same time because they're going to be in the same position. They're going to be sitting with their hip at 90 and their knee flexed at 90, but everything else should be neutral, so they shouldn't have any internal or external rotation yet. So she's at 0 degrees. So first I'm going to look at her active and passive range of motion. So Jamie, I'm going to have you bring your foot as far as you can to the left side.
And what movement is that?
So this is external rotation.
Frontal.
Oh, he's going to have that answer.
Good job, Sarah. You know your stuff.
Sarah, she passed this course. Line colors. So guys, you're going to see the foot come in and you're going to get confused, right? You're going to look at the distal end and you're going to say, that's internal rotation. It isn't, okay? You have to think about the hip.
That's it. You bring your foot to the... Oh, yeah, I'll do passive. And then Jamie's pretty tight, so I can only get her a little bit farther.
What do we think's tighter in Jamie?
Thanks.
The lateral bands.
Well, what's that?
The ligaments on the lateral aspect.
Yeah, I think she has tight iliotibial bands, okay? And the tensor fascia latae is tight too, yeah. Were you going to say that too, Michael?
Yes. All right, so then I'll measure the external rotation. The axis is over the midpoint of the patella. The stable is perpendicular to the floor, and then the movable is going to be in the midline of the tibia. So I'm going to have you do the same motion and bring your foot to the left side. So she's at about 30 degrees, and then I'm going to bring her to about 35. You want to make sure to watch her hip. It's the contralateral hip. That's a substitution.
I was flexing too.
Yeah.
Yeah.
We were doing that, yeah.
So I couldn't get it much farther. The end feel is firm. What's the plane? Transverse. And the axis?
Vertical.
Alright, so then for internal rotation, I'm going to have Jamie move her foot to the right side. And back down. And then I'm going to bring her passively. And I can see her already bringing her hip up because she's really tight here.
What do you think's tight? Actually, the ischiofemoral ligament could be tight because that comes from posterior and affects internal rotation, but piriformis is probably pretty tight too. Got tight piriformis.
So then everything's positioned the same. The axis is on the midpoint of the patella. The stable arm is perpendicular to the floor, and the movable is along the midline of the tibia. So Jamie, we'll have you do that motion again. And I'm watching the hip too, because she's already kind of coming up.
So we're going to give her some piriformis stretches.
And you actually get to like 38 there.
She got that?
Yeah, not so bad. And maybe 1 or 2 degrees more passively.
We all measured each other and we're all tight.
Yeah, so the norm's 0 to 45. Oh well. Any questions on that one?